Hello everyone, this is Brainless Medico and I am Dr. Manoj, and today we are going to learn one more topic, iron profile. Yeah, it's not actually a definition. What it actually means under this definition, what we are going to learn, that I stated in the definition. Iron profile refers to a group of laboratory investigation used to assess body iron status, iron transport and iron storage, and to different various cause of anemia. Okay, so components what are included in this iron profile are serum iron, serum ferritin, TIBC, total iron binding capacity, then transferrin saturation. First we will learn about serum iron. Amount of circulating iron bound to transferrin in plasma. So normal value will be 60 to 170 microgram per deciliter. This will be decreased in cases like iron deficiency anemia. If you have not watched this iron deficiency anemia, it's already available. You can go and watch. Then anemia of chronic disease and chronic infection. It will be increased in hemolytic anemia. Even this is available video. You can watch it. Thalassemia, it is also there. Hemochromatosis. Then coming to serum ferritin, reflects iron stores in the body. Normal value in males 300 to 300 nanogram per ml and in females 15 to 200 nanogram per ml. It will be decreased in iron deficiency anemia and will be increased in inflammation, chronic disease, liver disease and iron overload. And the important point about this serum ferritin is an acute phase reactant. You need to remember, important point. Then coming to third one, total iron binding capacity, TIBC. Usually we call it as TIBC. Don't get confused. In exam they won't give total iron binding capacity. They just mention TIBC. So definition goes like this: indirect measure of transferrin level. So normal value goes like this: 250 to 450 microgram per dl. You need to remember the SI units of these values, because if you mention micro instead of nano, it will be a large gap difference. Okay, complete error will be seen. So you have to remember the SI units. Then coming to, it will be increased in iron deficiency anemia and decreased in anemia of chronic disease, malnutrition and liver disease. Transferrin saturation, it's a calculation. We usually do it in percentage. So serum iron divided by TIBC into 100. So normal value will be 200 to 20 to 45. Decreased in iron deficiency anemia and increased in iron overload states. And then we have iron profile in common anemias. In iron deficiency anemia, as I said, serum iron, ferritin will be reduced and TIBC will be increased and transferrin saturation will be reduced. Why? You can learn this topic very detailedly in the iron deficiency anemia. There I discussed why it will be increased and decreased. Then in anemia of chronic diseases, we see serum iron will be reduced, normal or increased we'll see in the level of ferritin. Then we have TIBC reduced, transferrin saturation will be reduced. Thalassemia, normally iron's level will not be varied, or it may be increased, not ever decreased. But ferritin will be normal, TIBC will be normal and transferrin saturation will be increased. Clinical uses of iron profile. Diagnosis of iron deficiency anemia, very important part. This iron profile plays vital role in diagnosis of iron deficiency anemia. So after watching this video, go and watch my iron deficiency anemia. So it won't be that complicated when you learn individually later or somewhere here and there. So then differentiation of microcytic anemia. It is one of the clinical feature where in iron deficiency anemia you are going to see microcytic hyperchromic anemia. Then assessment of iron overload. Then monitoring response to iron therapy. If there is a iron deficiency anemia, you are going to treat the patient with the oral or intravenous iron therapy. If you have to monitor whether the therapy is useful or not, or like any changes is seen, so you are going to check the iron profile. Then coming to examples, ferritin is the best indicator. Even in iron deficiency anemia, I mentioned it. TIBC increases in iron deficiency anemia, and use the comment section. There is one condition where TIBC will be reduced and other all components will be increased. So let me know in the comment section. Then anemia of chronic disease shows normal or high ferritin. Transferrin saturation is less than 15% suggests iron deficiency. And summary, just read it. Iron profile is an essential diagnostic tool in evaluating anemia. Interpretation of serum iron, ferritin, TIBC and transferrin saturation helps accurately differentiating iron deficiency from other microcytic anemia. The overall point why we are studying this iron profile is like you have to differentiate iron deficiency anemia with the other type of anemias. So this is one topic where you can easily consider, like if you study well, you can differentiate iron deficiency anemia with the other anemia. So I hope that was clear. Thank you.